Hello, this is Dr. Noah Erickson from Enliven Functional Medicine. Do you have a child on the autism spectrum who struggles with speech? Well, probably our number one most requested topic that we get asked about is methyl B12 injections. So first of all, yes, we have them. And secondly, people say, how do you test for this type of therapy if my child might be an ideal candidate or a good fit for methyl B12 injections? Well, here's three great answers, and this is what we based our program on. Number one, genetics and something called a methylation test. So many of you are familiar with methyl B12 and how it works with something called the methylation cycle, and maybe you've heard of or had your MTHFR gene tested for. So we look at this panel of gene, what they call SNPs, or these markers of gene indicators. We also look at this test that says, are they doing something called methylation, which in short, are you turning on and off gene switches, some of which can actually influence brain function, of which can influence how someone speaks. So that's first and foremost, methylation testing and looking at these markers. Number two, we do run blood tests of something called B12 and folate, and they can be extremely helpful. Now, the third thing that we do is looking at something called methylmalonic acid, MMA, you'd say for short. That's a great indicator of how we're using B12 to process. So these three markers, again, are how we make clinical decision if your child would be an ideal candidate for B12 injections, known as MB12 or methyl B12 injections. Again, to recap, number one, we said there's a methylation panel with gene markers, these little things called SNPs, like MTHFR. Number two, we look at vitamin B12 and folate testing. And number three, the marker called methylmalonic acid. So thanks for watching, everyone. I certainly hope this helps. For more information, check us out online, enlivenfm.com. That's enlivenfm.com. And this is Dr. Noah Erickson wishing you a great day.